Kerio Valley in Baringo North is home to some of the deadliest snakes in the world, which have for long claimed lives or left victims disabled. Many families in the area bear scars as testimony of the danger they live with daily. The high-risk regions are Kapkoiwo, Kagir, Baraketwa, Kapkomon, Rondinin and Repeko. The area's rocky terrain and humid weather provide a conducive home for cobras, black mambas, puff adder, viper and pythons.
Pythons are very common here in Baringo County, but this one is a bit friendly. And according to snake handlers, pythons are not poisonous, unlike the black mamba and the puff adder. When you're bitten by a black mamba, you need treatment in the next 15 minutes.
Nyoka imekuwa disaster. Sisi tunasikia watu wanasemanga wanatangaza njaa au vita nini ikuwe disaster. Nyoka hapa imekuwa national disaster kwa area boy. Ndio ile kitu watu wanafikiria kwa area hii waseme tuame area tuachie wanyama waishi huko. Juu imekuwa dangerous.
Jua inawaka hivi. Ndio sasa wanajaribu kutafuta mahali iko maji na mahali wanaweza lala baridi. Sasa ukiingia kitu kama mattress hapo inaweza lala hapo.
Na ukitafuta maji anatafuta mbili. Maji binadamu.
Kuna ile nyoka ile inapandanga mpaka hata kitanda. Sasa ile unalala usiku unashtukia naye ameingia kwa kitanda yako hapo. Amelala karibu na wewe hapo. Especially kuna hii nyoka nyingine inaitwa fafata. Hiyo sasa unasikia unaona yeye anakuja kabisa direct mpaka mnakuja lala na yeye. Lakini ukikusa ndio hapo sasa ndio naanza kutoa fujo. Cobra naye kuona mkiogutana namna hiyo, akiona maji yako anaanza kusimama hivi na kumwaga hiyo sumu yake. Na ukikimbia hata naye nakimbia narudi nyuma na wacha na wewe.
Kitembea kidogo unakutana. Kitembea kidogo ukiingia kwa hiyo mlima unakutana. Unakuta kama yako mita hapo kwa juu. Ikiona wewe na nyamaza huko. Ukipita kidogo ndio anataramukia. Sasa ya leo inakuwa mbaya sababu ukiona wewe na ngoja wewe kama panya. Hawezi kimbia kama ya zamani. Anangoja wewe alafu ukienda tu unafuata wewe. Kwanza watoto. Watoto ndio napukusa. Saidi sijui anafikiria ni panya ama anafikiria ni nini.
Hapa tutembee bila tochi na unajua hatari iko. Unaomba Mungu unatoka, alafu unaangalia kuna nini hapa unapita. Wewe ukapita ovyo. Hata watoto wanajua. Wakienda mpaka kisa inaingia, kila mtu anakimbia aingie kwa nyumba.
About 10 years or 20 years ago, the snake bite cases were not as rampant as it is as of now. And this is because of the changes in settlement in human population. As people are expanding in settlement, they go into those areas that were previously inhabited, and then you find they are in contact with snakes. During such times, they must make sure that they clear water from the homesteads, and if need be, they can give some outside where they can access that, and also make a lot of cleanliness in the house, because rodents are attracted by that, particularly the rats, and this is what the snakes follow.
Prevalence in Baringo County, right now we have about probably 200 to 300 people bitten per month. And probably, depending on the season, it can go as high as 500 people.
According to the Snakebite Rescue Rehabilitation and Research Center, Kenya, about 15 to 25 people lose their lives every day due to snake bites, while over 100 people are being amputated, causing them permanent disabilities. Records at the Kenyan Wildlife Service office in Baringo County shows the region has the highest cases of snake bites in Kenya, with 10 to 20 cases reported on a weekly basis. Between 2017 and 2018, for instance, 24 deaths and 58 snake bites injuries were reported in Baringo.
Lack of anti-venom, unequipped health facilities and poor infrastructure are some of the factors contributing to the high death rate of snake bites in this region.
Hapa ni area malaria, hapa ni area manyako kuuma watu. Ambulance hapa mpaka Partabo. Na Partabo sasa ni karibu almost 30 something kilometers pata ambulance. Kapartonjo ni hiyo kilomita 20. Paruwesa ni hiyo kilomita ngine tena. Sasa katika Watita Kipsarma tuna ambulance.
Kwake, alafu nyumba yake yenye alikuwa anaishi ndio hii. This lowland ya Kerio Valley. Mtu akiumwa, tuseme kama Paruwesa huko chini, lazima ama Kenyachi, lazima asafirishwe mpaka Kabarnet, mahali anaweza pata dawa ya kutibu. Na hiyo distance ni zaidi ya 65 kilometers. Na hakuna magari. Mpaka ukotese gari ya mtu fulani, upeleke naye mtu wako mpaka huko hospitali. Na mara mingi watu hukufia njiani kabla ya hawajafikishwa hospitali.
Daktari ni mmoja tu peke yake, serving almost a whole location. So the county government wamerelax kwa kazi yao.
Lakini anakuja kama mara 2 ama 3. Hawezi kuja kila siku. Hasa kila Jumamosi, Jumaa anakaa kipika saa 3 hivi saa 4 yeye ametoka.
Kitu kitokea tu weekend hakuna daktari.
A spot check by NTV crew revealed that majority of the dispensaries in Baringo North don't operate on weekends. From Kapkoiwa, Emosos to Kapluk, all dispensaries were indeed closed on Saturday and Sunday. In case of an emergency, patients have to travel to Kabratonjo or Kabarnet.
Na hospitali yuko hapa. Ameletwa tawa, lakini hiyo tawa haiwezi tumika sababu kuna daktari ile anajua kutibu hawa.
At Kapluk Dispensary, anti-venom was stocked in 2018, but the nurse in charge of the facility, who did not want to appear on camera, said she does not have knowledge on how to administer the drug to a patient. The drug expiry date is on April 2019.
Mbona mkaleta hiyo tawa kuja kufanya nini? Na kama mnajua hakuna hiyo daktari mwenye anajua, si wangeleta daktari mwenye anajua kutumia hiyo dawa. Tuko na nurse moja. Na area hii dispensary ina site ya watu 3,000. Na inachukua sub-locations karibu 4.
Not all our nurses or not all our health workers are able to administer this particular drug. So we are addressing it by actually bringing in people specialists who can train these health workers. So we are addressing that currently right now. And that should be a problem that we will sort out very soon.
Another challenge is that some of the dispensaries don't have refrigerators to store anti-venom due to lack of electricity.
We upgrade these dispensaries, iwe health centers, ili tupate yule naitwa clinical officer ambaye anaweza kutumikia wananchi kwa njia rahisi. Serikali sasa wanachukua madaktari wanaenda weka kwa headquarters huko tu. Huko madaktari na cha mingi. Hawatoe kutoka huko, mtu akiambiwa aenda upande wa Kablu kama Kerio Valley huko, anasema kama ni hivyo afadhali mnipeleke upande wa Masop, yani the Avalanche. Wafanya kazi huko. Wanasema wanaokopa upande wa chini pande huu kwa sababu ya vitu nyingi. Lakini mtu ameachiliwa kazi na lazima afanye kazi mahali popote katika Jamhuri ya Kenya.
Some of the residents in the area have taken to killing the snakes and taking them to hospitals to help doctors identify the venom and hence get the antidote faster.
Kama umeumwa na cobra, huwezi tumiwa ya black mamba. Hata kama ameuma mtu na hiyo nyoka ipotee, mpaka tutafute kabisa. Kwa sababu tukifika hospitali sasa, huwezi ukiambiwa ni nyoka aliniuma, sasa utaulizwa ni nyoka gani?
There are few snake bites that are treated with the monovalent antivenom, which the species of those snakes don't normally just come out in the open just like that. They are very reclusive animals.
Tuliletewa dawa kidogo na ikaisha kwa watu kwa sababu hiyo ni kama malaria kwetu.
In the last 3 to 4 months or so, we didn't have antivenom in all our facilities, but currently we have antivenom in most of our facilities, especially the snake bite prone areas. As a county, we had not put it among our top 10 essential list of medicine, and now it is among our essential drugs that we cannot do without.
Kuna plan ya kuleta motorbike yenye itakuwa na antivenom na daktari atakuwa anaendesha. We only wanted to see it rolling because it has taken long.
Strengthening our community health strategy so that we can be able to train a few community health volunteers to be able to administer first aid and probably even give the first dose of anti-venom.
In October 2017, a study published in the PLO's Neglected Tropical Diseases Journal revealed potentially disturbing deficiencies of snakebite treatment capability in East Africa.
All antivenoms we have in the country right now are made from venom harvested from snakes that are not found within Kenya. So this compounds the problems of the antivenom efficacy whenever we're managing our snakebite victims. The technology that produces the current antivenoms is quite old, 150 years old, and we think there's still much to be done for it to be better and to be more efficacious. Through our research, we've got to discover that most of our health workers are not trained in the management of snake bites. That compounds the problem and the outcomes from snake bites. This is a foreign particle being introduced into the body. There's normally risks of adverse reactions coming from it. So the more you administer as well, the more risks of adverse reactions you have. And we have had reports of clinicians reporting such cases. I'm losing patients not from the snake, but from the adverse reactions emanating from administering this snake antivenom.
A shortage of antivenom supply across the continent began less than 3 years ago after the production of one of the continent's most effective antivenoms was discontinued by its French manufacturers over low profit claims.
The antivenom was considered efficacious against most snakes of medical importance, even in Kenya. Most snakebite victims stopped coming to the hospitals because they will not find any antivenom. But the case fatality rate of snake bites increased from 2% to 12% and even higher. We started having 2-3 antivenoms that are registered, and they are one is of Mexican origin and one is of two others are of Indian origin.
It is estimated that 85% of snakebite victims opt for traditional healers in Baringo North. Esther Ewoi, a traditional healer in Kapkirok village, is the only ray of hope to many victims of snakebites in the remote area. Esther, who is popularly referred to as Dr. Nyoka, has perfected treatment of snakebites through application of a rare healing stone, popularly known as the black stone. The 57-year-old healer says she learned the science from her husband, who inherited it from his employer, Jonathan Liki, who had hired him as a snake handler near Lake Baringo.
Nyoka alikuwa hapa kwa mzee Liki. Ni sumu ya nyoka, yani ile alikamuliwa. Natoka meupe kama maziwa, lakini kuingia glasi kukauka, mara anakuwa kama chumvi. Sasa ndio anaenda kutengenezwa, anakuwa hivi. Anapelekwa England.
Esther passionately explains about her miracle healing black stone, which is saving lives.
Dawa kwa manyoka ile ya sumu yoyote, kutoka cobra, septum cobra, papada, black mamba. Kama ni nyoka anakuuma, damu anatoka. Sasa wewe ukilete, ninaona ni hapa, ninasafisha, alafu nichukue nisafishe na nipangusie akauke kama hapa, nimuweke hivi. Unaona anamrukia hivi. Sasa wakati anarukia ninawacha. Sasa wakati nikiwacha, yeye mwenyewe anatetemesha hivi. Na sababu anatetemesha hivi, mkono wangu haiko. Na ukileta ukisema ni nyoka na si ya sumu, atashika. Ananyonya hiyo sumu, wakati hapa sasa anaanza kumvura. Wakati anafura anaanguka. Sasa nikitoa namna hii ninakuonesha. Alafu sasa nitafinya hapa hivi, nimwage sumu. Nikimaliza kumwaga hiyo sasa nirudie niweke. anavuta tena, unaona tena anafura kidogo, yani sumu ya kwanza ndio amevuta mingi. Sasa anaanguka. Nitoe hiyo nimwage, nirudie niweke mara 3. Unasikia uchungu. Unasikia uchungu kama kobra hiyo. Utasikia uchungu saa mzima. Utaenda kukula turungi nikikutibu leo, kesho, alafu kesho kuta kunywa maziwa. Enda kwa hospitali umalize na dawa ya tetanus.
According to Esther, the stone can be used several times on different victims so long as it is sterilized in boiling water for at least 15 minutes before it is soaked in milk for 2 hours.
Nimekuwa na muda mwaka 60 nikitumia. Nimesaidia watu 18,017 yote wako hai. Ninaweza kukutisha shilingi 4,000. Haya ukimulia naweza 3.
Sasa hiyo ndio tunasema Mungu yetu ya pili. Tunatumia sasa mawe kadogo size.
Have you seen that black stone?
Yeah,
What do you think?
I've seen it. It has no basis at all in arresting any pathology arising from snake bites. Yeah, so at the end of the day, snake bite victims have to present to hospital. Otherwise, then we wouldn't be experiencing the deaths that we're experiencing right now from snake bites or the loss of limbs.
Snakebite incidents, which tend to affect the poorest and most vulnerable people in society, have been ignored for long. It is only recently that the condition began getting renewed attention. In 2017, the World Health Organization included it in its Category A list of neglected tropical diseases. The Institute of Primate Research has set up the Kenya Snakebite Research and Intervention Center, the first of its kind in sub-Saharan Africa, which will facilitate development of locally produced anti-venoms that will be affordable and thus accessible to needy Kenyans.
Is to come up with what we are calling newer generation therapies on management of snake bites. The ideal would be to produce these anti-venoms with the venom found from snakes within our region, and that will, of course, increase the efficacy and outcomes whenever these antivenoms are used in managing our patients. We have 5 to 10 years to work on this and come up with something that we think and feel will be much better than what we have now.
This is only the first step towards shining a brighter light on this neglected problem and attracting the much-needed resources to build a better system for saving lives. Snake bites leading to limb amputations and even death have dramatically gone up in the past decade. Section 25 of the Wildlife Management and Conservation Act 2013 stipulates that in case of death, 5 million shillings is paid to victims. Cases of injury resulting in permanent disability will be compensated 3 million shillings according to the Act. Depending on extent of injury, other injuries attract a minimum of 2 million shillings. Previously, compensation for deaths was 200,000 shillings, while a maximum of 50,000 shillings was given to injured persons. But affected families in Baringo County claim that they have not received any compensation for a period of 5 years.
Mimi nimejaza fomu yote. Wakaangalia hizo mafomu wakaniambia iko sawa. Sasa waenda tutakukujia anytime. Hatujui ni lini. So mpaka hapo sasa mimi nikashughulikia mambo yote mpaka ikanishinda.
Little Chepchirchir is also yet to receive compensation.
Tumepeana hiyo ripoti mpaka kwa kaita police kwa yule amekufa. Tukaingia hiyo ofisi kubwa. Ofisi ya mkubwa kabisa kuona huyu mtoto. Akatuambia mimi sina namna sasa. Sababu tumepeana hii report Nairobi. Tukakuja tu namna hiyo. Hatukupewa usaidizi yoyote. Mpaka siku hiyo sisi tukajinyamazia tu. Sasa tutaenda wapi?
KWS. Pili wanapata pesa kutoka kwa watalii, hizi pesa yote wanapelekanga wapi? Last year, even last month, hata juzi nilitoka Nairobi. Nikaonelea sitafuata tena, nilikata kauli kusema sitafuata tena kwa sababu Mungu yuko. ataona vile atacompensate mimi.
Hawaja compensate mtu kwa hii Baringo County since 2014. Nikamwambia kwa nini?
It is only that we start the process from at the ground level here and then forward them to the KWS headquarters where they are also consolidated and taken to the ministry.
KWS is always on the firing line, but really it shouldn't be KWS because it's beyond us in terms of, and it's not even our mandate to actually do compensation. So that is the ministry that processes the money which comes from Treasury, and that in turn is allocated by Parliament.
Compensation claims from victims of human-wildlife conflict in the last 5 years have hit to 15 billion shillings. This is according to the Ministry of Tourism and Wildlife. The claims are for residents who have been killed or injured and those whose property has been destroyed by elephants and other animals. Compensation claims are filed through the county wildlife committees.
All those cases are processed and brought. And then there is just one more committee that they have to go through, which is the ministerial committee. If they find that they have money, but which can only cater for, say, 100 cases, and they have passed 300 cases, so it means it's only a third. And juggling as to where should you now put this 100 million instead of 300 million can be fairly a good challenge. But they probably would use other criterions, like saying maybe let's pay the ones that came earliest or something, just so that we make sure we are fair to all the counties. If somebody is bitten by a snake or injured by another animal, and then they go to hospital, they get treatment, there is no report, that becomes very complicated, and particularly because it's evidence trailed. They will try and find out, okay, you say you were bitten by a snake, where? And then they will say, oh, it was at this finger, and maybe by that time that sign is not there. So that would be a big challenge even to that committee, and it could comprise some of the cases where they say, no, we are not taking this to be a genuine case, and probably the person was genuinely bitten.
In 2017, snakebite victims required 1.5 billion shillings compensation, while the Wildlife Ministry had only budgeted for 250 million shillings. 62% of claims received between 2014 and 2016 arose from snakebites, according to KWS. 274 cases were approved, with each taking 5 million shillings.
We've only been able to deal with the issue of human life. That is what the ministry now prioritized, and they said, look, I think the communities have been much more hit in this area, and therefore the money that we have received, we're going to prioritize and pay human death cases first. As we wait for the money, as we debate, as we ask support from all, including our parliament, to be able to give this money.
Taxpayers will not compensate individuals hurt or killed from snakebites if a proposed law is approved by Parliament. The Ministry of Tourism and Wildlife is lobbying Parliament to amend the Act to remove claims for snakebites and destruction of crops in order to sustain the huge bill.
Clearly, we can see that the amount of money that is required, if we go the full range of all the categories, we may not be able to sustain that kind of situation.
Efforts to get a comment from the Ministry of Tourism and Wildlife were unsuccessful. Shortage of anti-venom, a lack of awareness among health workers, poor access to health services are major factors increasing morbidity and mortality from snakebites. Thus, until those challenges get solved, the nightmare of snakebites may continue to haunt many in this region.